Here. Not something that you normally talk about that much in school as a student, but I'll tell you the impact that you can have on the legislative process and on moving our profession forward can be pretty significant, especially at the student level. Because what I have found is that when I speak with legislators, and I speak with dozens all the time. In fact, next week I'll be up in Sacramento meeting with legislators all day Tuesday. Um, that their basic understanding of what we do is pretty amazing. That they don't, most legislators don't know that we're at the doctorate level of the profession. They don't know what the skill level is, the scope of practice. And as a student, you can, and in your early years in your career, just meeting the legislator and talking to him about what you do has a huge impact on setting the stage for any legislation. So we're going to talk about some of the California issues and legislative system here, and a little bit about the APTA and advocacy through a couple different channels, through the Political Action Committee and Government Affairs Committee, and just different ways, different things you can do to be active to help promote the profession. So advocacy does really matter to all of us. We have to establish our credibility in the profession, and our credibility is really based upon people's knowledge of what we do. And also, you'd be amazed how many people that make decisions on our behalf in terms of moving a profession forward were former patients, and that's kind of how they a lot of times they learn about it. We also want to just highlight what issues are important to us in statute and regulation. Statute is another word for the law. Regulations are the implementation. So the statute is kind of the why, and the regulations are the how of how we do things. And statutes are developed by the legislature, and the regulations are developed by the different committees and different branches of the government. And we always kind of put it in terms of how what we do affects the consumer, affects our patients. We never want to make this self-serving in terms of what we advocate for. We advocate for access to care, we advocate for early access to care, and for proper care, and by the appropriate individuals. And we're going to address some specific legislation here too. But if you look at the national level of what APTA does, you're going to see a lot of different things that are public facing, forward facing, to the public as to their access to information. And there's a big effort, which is the Choose PT, and you can go to that website. That's the forward-facing website for APTA nationally to help connect patients to us. In fact, in there, once you become a physical therapist, you can, and you're a member, you can list yourself, and people can find, if you find a PT, when they look to find a PT, they can put in their geographic area, the area of specialization that they're looking for, and they can find you. So it's kind of a nice benefit of being a member of the APTA. So California's legislative and political climate is quite interesting, and it's quite complex. And this is kind of like how a bill becomes a law 101. It's a pretty basic approach. And I'll talk to you about how we develop some of our legislative efforts and what we're doing. When a bill is introduced, it's usually brought forward by a special interest group. So it's a bill that we did the last 2 years that was to increase access by decreasing the pre-authorization process, by allowing us to see patients without interference by an insurance company. That concept came from us, and we wrote it up and we sent it into legislative council, which is the arm of the government that determines where your idea for a bill should go and where it should go into law. And you have to have a legislator that is going to sponsor you to bring it, so that they can do that analysis. So once you have that, then you have the bill language written up. You try to tweak it as much as you can, but then it goes into one side of the legislature, either the Assembly or the Senate in California, depending upon who your legislator is. And they take it forward, and it goes to the Rules Committee, which determines what pathway it's going to take. And it goes to different committees. So quite often our bills either go through the Business and Professions Committee if it has to do with our Practice Act, or if it has to do with healthcare policy in the state, it goes through the Health Committee. So it goes to that committee, they vote on it, we do hearings, so we'll usually have one or two representatives from the state and our lobbyists that we have give testimony, and you're sitting across the table or next to your opposition who give their testimony, and then the bill is voted on. And if it gets out of that committee, it may go to a second committee, or it may go to what they call the Appropriations Committee, and that committee determines if there's a cost associated with it to the state. And that could be a real big hurdle to a bill if they put a cost on it that you didn't expect, because the state is going to cost some money to enforce it and to implement the bill. And if it gets through that committee, then it goes to the floor. So it'll go to the floor of the assembly where they vote on it. And then it goes to the other side. So it starts the whole process over in the Senate. If they modify the bill, then it has to go back to the original House for what they call concurrence, which means that they agree to the changes that the other side of the legislature made to it. And then if everything goes well, it goes to the governor's desk. So we had a bill last year, AB 931, Assembly Bill 931, which would allow us as physical therapists to see a patient for 12 visits without any interference with any insurance company. And I think I testified in 4 different committees and met with dozens of legislators on it. And we got it through both sides, the Assembly and the Senate, with only 2 no votes out of the entire legislature. And we got it through, and it went to the governor's desk, and Governor Newsom vetoed it. So you can spend 2 years on a bill and have one person decide that they don't want to do it. So that was quite a defeat for us, but it also raised the issue of access to physical therapy as an important issue in the legislature, and could set us up for another attempt or to tag on to somebody else's bill down the road. So in California, we fall under, from a practice standpoint, the Business and Professions Code, Section 2600. So those of you who will be taking the board exams in California and want to be licensed in California will have to know this section of the Business and Professions Code quite well to understand the law side. So they have this, what they call the jurisprudence exam that occurs, and each state has their own exam. And so that's in addition to your national board. So although your national boards are uniform throughout the country, each state may have a separate law exam. And that's under the jurisdiction of the PT Licensing Board. The Licensing Board does not set up laws for, like I spoke about, like early access to PT and that sort of thing. That just regulates what we do as physical therapists. It doesn't regulate how the public accesses us and that sort of thing. So there's lots that goes on within the actual legislature to get a bill through. This is in 2024. We're in what we call the second year of a 2-year legislative session. It's best to introduce a bill in the first of the 2-year sessions, because then you can have a bill take 2 years to get through the process. If you introduce it in the second year, you have to try to get it through both houses in 1 year, which can be kind of tough. And in California right now, we've had distractions of COVID that have restricted access. So that's that's eased up now. That they're actually ripping down our state capitol. All the buildings other than the main rotunda is staying intact, but all of the offices and hearing rooms are all being leveled, and they're rebuilding it. So the legislators are now in all these different buildings around the Capitol, and it's a little bit harder to access all the legislators. They're not all in one place. And in California, we have, you can see that there's a Democratic majority. So if you have a Republican introduce a bill, it's a little bit tougher to get it through the legislature. And if you get the Democrat to introduce a bill on your behalf, you probably have a better chance of getting it through. It doesn't mean Republican bills don't get through. It's just that if it's a partisan issue, then obviously it's a little more difficult. So right now we have in California, they just announced recently that there's a $68 billion budget deficit. This is kind of strange for California, since we've had a surplus year over year over year, and all of a sudden we have this huge budget deficit. And that doesn't mean that they're going to actually, shut down different programs and things in the state, because we do have a reserve that is quite huge that they can tap into. It just means from a budgetary standpoint that there's a lot more going out. So bills that have an impact on the state from a cost standpoint will be tougher to get through. So if there's any like enforcement of the bill, or that has to go, let's say you have something that has to go through the Department of Insurance, the Department of Managed Healthcare for implementation, that may cost the state, and they may not want to put it through. And then you have all these other issues that are kind of hovering over us, like Artificial intelligence is taking precedent in terms of some legislation coming up. Homelessness, public safety, obviously is a big issue, and workforce shortages and costs. Right now, we're dealing with a bill that was introduced, that was passed last year, having to do with minimum wage, which sets minimum wage at $25 for every employee in a healthcare facility. And we're trying to determine, in fact, I was on a call for an hour and a half yesterday with attorneys to see if that applies to physical therapy clinics specifically, because it means everybody, your PT techs, everybody would have to be paid at least a $25 minimum wage, which impacts everybody. It impacts the amount that you will make as a physical therapist. If the techs are at a certain level, minimum level, that's less money to go around within the practice. So it's an issue in California that we have to deal with. So the way that we have access to trying to get to legislators is through our political action committee. And a political action committee is something you've heard of before, and it's basically the money-making arm of any type of association. And the political action committee is really important in raising funds for to get us access to different events put on by legislators. They do lunches, they do breakfast, they do social events, and you buy a ticket and you go there and you can go meet with a legislator. And it sounds kind of strange, but that's just kind of how the process works. And either you participate or you don't participate in it. But raising money is a big effort for us. And the priorities of the political action committees is really kind of just to get in the door, to get relationships with the legislators and build a local network. And even if you don't have an issue that is up in front of the legislature at that point in time, it's the relationships with those legislators that help us get things passed down the road. And I can't tell you how many of those relationships have paid off for us in the past. So our political action committee in the California PT Association includes some students. So we have student positions available. So any of you are kind of interested in this stuff, you just reach out to me directly. And I have the ability as president to appoint people to committees. So it's a fun committee to be on. It kind of gets you into the process, and it raises your awareness of all the issues going on in physical therapy. So one of the things that's really important to note is that, democracy is not the government of the people, it's rather the government by the people who participate. And you'd be so surprised how much one voice in the talking to legislators can make a difference. Letters and everything else can have a huge impact, but just the personal relationships of a constituent, somebody in a district of a legislator, influencing that legislator, can be extremely important. And so you just have to determine at what level you can participate in. Is it attending a local coffee event that the legislator has at a local coffee shop, which our legislator, Jackie Irwin, that carried our bill last year in my area, in Thousand Oaks area, she has these quarterly coffees at a local coffee shop. People come and just show up and talk to her, and it's really kind of cool. Writing letters is always effective. That's something we ask for. Having meetings with the legislators. Sometimes legislators show up at some of the community events like farmers markets, making phone calls to say you support a bill. So when you get like a call to action, any of these activities make a difference and impact the legislators, and they respond to you. They're really, interested into what you have to say. So there's a lot of avenues. Obviously, the normal media and social media, reposting things, posting things on legislators' web pages or on their social sites like Twitter and that sort of thing, or tagging them in Twitter, makes a big difference because they take notice of that, and it influences the legislators, and helping legislators out even with their campaigns, and participating in phone banks that they have, or dropping materials off or something along that line has a big impact. So some of the state issues we've had recently in California that we've had a fair amount of input on is in California, when we went to the doctoral level, the Cal State University system schools that had programs were at the master's level, and the Cal State system is by charter only supposed to offer up to a master's degree, where the UC system is the doctoral level entity in the state of California. The only doctoral level degrees that were offered by CSU system was a doctoral of education that was approved years ago. So when physical therapy went to doctoral level, we either had to change to that level to be accredited, or all those programs at Fresno, Long Beach, Sacramento, Cal State Northridge, San Diego, Long Beach would all have to close. And we were able to get a law through to allow the CSU system to offer a doctor of physical therapy. So the CSU system only offers really two doctoral levels right now, is education and the physical therapy. So I thought that's kind of fascinating. So CPTA was a sponsor of that bill. Direct access, as you know, is now 10 years old as of this year, and we've had direct access, and it's getting wider and wider acceptance. And we'll talk about the athletic trainers issue here in a minute. And reimbursement is always on our agenda, and we're doing bills all the time on something with having to do with access to care. Legislatively, you can't set pricing, so that's not something we can do and say that everybody has to pay us a certain amount. The legislature will never approve that, will never stand up in court, so that would not be something we can do. But issues that influence reimbursement we can deal with. Let's see, it's not changing here. So how can you help? You can help just by advocating for your profession. When we do a call to action, to go ahead and make those phone calls or use the letter template. There's so many easy ways now where you can cut and paste your letters, send it to the legislator's office through their website. It won't take you more than 5 minutes. Some of you, it'll take you 2 minutes. And you'd be surprised, the legislator will respond to you, and you go on record, and those letters really have a huge impact. Right now we have a big effort going on with our Medicare fee schedule that is up for, there's some legislation going on now, which I'll mention here in a minute, and we're asking for a call to action on that. We've had what we call a PAC Cub Challenge here in California, where we've challenged the different schools to compete against each other for student participation. And it's basically the schools that have the most students participating, even at a $10 donation, can win an award. You get a big trophy. You get to come to our PAC annual dinner. Mount St. Mary's has kind of smoked everybody for the last couple of years, and it's time for the other schools to kind of get on board too. So in terms of what our Government Affairs Committee does, which is different than the PAC, so this is a committee that we have a lot of PTs involved with from different practice areas. And every year we get a list of bills that affect healthcare, some physical therapy, some, it may be a bill that we're sponsoring, but it's usually taking a look at usually over 1,000 bills that come before the legislature every year, and a big chunk of those have to do with healthcare, and they analyze them, and we take positions on bills, whether we support the bill, whether we oppose the bill, whether we want to testify for or against the bill or write letters or just watch the bill. And we're doing this all the time and following these bills, and it puts physical therapists basically on record with the legislature that we're taking positions on bills that affect our patients. We don't just take positions on bills that affect us as physical therapists. We do it on bills that affect us, our patients. And they may indirectly or directly affect physical therapy. They may have something to do with access to care. They may have something to do with universal health care coverage that has gone in front of the legislature in California. Just general health policy. We've taken positions on gun safety, on things like that. Some things to do with the pandemic. We take positions on. They don't necessarily affect what we do on a day-to-day basis, but they affect the health care of society. So I kind of was going through this. Actually, I found this in my garage, cleaning my garage last year, and it was a copy of the very first bill that I was involved with back in 1993. So I know some of you weren't born yet. But that's when I got involved with my first testimony on a bill, and it had to do with allowing physicians to utilize an unlicensed person to provide physical therapy in their offices. And whether you know it or not, in California, a physician is authorized to do anything that a physical therapist can do. Should they do it? Can they do it? That's a different question. But under their license, they can actually do physical therapy. But this bill would have allowed them to have somebody work under their direction to do physical therapy. Now, isn't that kind of ridiculous? So that was a bill that we fought, and I was on the Government Affairs Committee back then, and I testified on it, and we got the bill defeated. And then, wouldn't you know it, about a month or so later, within the Medical Board of California, they brought it up, and they were going to try to make it legal in their Practice Act by expanding their scope of practice through their committee, through their medical board. And what happened was their attorney saw that they were doing this as an attorney assigned to every board, And the attorney said, hey, wait a minute, there was just a bill that got defeated, and you guys can't, if a bill got defeated that wouldn't allow you to do it, you can't create underground legislation and basically say that you now have the authority to do it. So that got killed back in 1993. So just kind of an interesting thing. So that got me kind of jazzed up about getting involved. So here are some of the issues we're facing right now. Let's go into these in terms of for California. We have bills coming up on animal rehab, athletic training, disability placards, and modernization of our whole practice act. So one of the first things, which is kind of interesting, and this isn't a CPTA bill, this is a bill brought forth by a group of independent physical therapists that have been doing animal rehab in the state for years. And the veterinary board has decided to crack down on them, saying that they're practicing veterinary medicine illegally, because there's nothing in our practice act that allows us to treat animals. Our practice act basically, it does say treating humans. So these people technically are doing this illegally. So we tried to work with the veterinary board and to say, okay, if a veterinarian supervises a physical therapist or orders physical therapy, that it should be legal for them to do it if the physical therapist has additional training in animal rehab. The veterinary board doesn't like that. They would say that the physical therapist has to be on site, or the veterinarian has to be on site with the physical therapist, and that's kind of ridiculous, meaning that I guess they want to employ the physical therapist. So they've been fighting this bill, but there's a good chance that it'll go through. It is a separate group from CPTA, but we're supporting them financially and with guidance with our lobbyists and trying to work with them. But this is kind of an interesting area. There's a lot of benefits to working with animals, and we think that if a veterinarian orders the therapy, that the physical therapist with the appropriate training should be able to do it. The biggest issue we have been dealing with for the last 15 years or so is licensure of athletic trainers. So I know this is near and dear to the heart of Patrick and other athletic trainers, because California is the only state in the country that does not license athletic trainers. And they have been trying to develop a board and a scope of practice for a number of years. The main issue that has caused them to fail in this effort is that the scope of practice, for the most part, goes above and beyond what a physical therapist can do in the state. It allows direct access and allows a lot of other things. However, in the last 2 years, they had introduced a bill last year that we were much more comfortable with, and it's actually the Physicians Assistants Association that has drastically opposed the bill, because it basically allows an athletic trainer to function as a physician's assistant, and they did not like that. So we're very close. Because they started this in a 2-year bill process, they pulled the bill last year and held it. And there's really only one area that we're asking them to modify, and that has to do with the supervision of the physician and the involvement of the physician. Right now, it's basically that they can function independently as long as they're following a protocol from a physician. It doesn't attach the physician to the actual athlete or patient or whatever. So we wanted a little bit more control over that area to mimic what's in other states, and we've used many other states as model practice act. So we're hoping that we'll get there this year with them. We're just tired of kind of fighting this, and we want to be partners with the athletic trainers. But this last year, we removed our opposition to the bill, and hopefully this year, as they reintroduce it, we will be in support and get this done once and for all. I'd like to have that under, well, I'm president, be able to see the athletic trainers licensed. Another area, which is kind of a little kind of funny little niche area, is allowing a physical therapist to authorize somebody to get a disabled placard for their motor vehicle. Right now, a physician, a chiropractor, a podiatrist, a PA, a nurse practitioner, a nurse midwife can all issue placards to patients, but a physical therapist can't. And if you look at the law specifically, it talks about that a chiropractor has the authority to determine if somebody has a disability involved in the lower extremity that decreases their mobility. Well, if a chiropractor has that ability in their practice, don't you think a physical therapist should have that ability to determine mobility issues? So this is a new bill for us that we plan to introduce this year. We're looking for an author right now, a legislator to author the bill, and we are going to try to go for this. We already determined where we want to put it in the law, so hopefully we will it will work. And this is one of those areas where we have to educate legislators on our scope of on what we do, what your education is, what you're trained in doing, why we should be able to do this, and it decreases administrative burden in other areas and allows patients greater access to being able to get their placards. So the big area that is really the biggest effort that I'm doing under my presidency. So I've been president now. I've just starting my 5th year. So I had one 3-year term, and I've got another 3-year term, and I'm in the 2nd year of my second 3-year term. And we started this in my 1st year, is a modernization of our Practice Act. Our Practice Act dates back to 1957, and it has only had a couple things that have been updated, such as direct access and the addition of wellness to our Practice Act. Those are really the only changes that we've had in the last 60 years. And so the OTs, occupational therapists, had their Practice Act developed about 20 years ago, or so, maybe less than that, 15 years ago, and theirs is much more modern than ours, allowing them much greater things to do. So we kind of like to get up there with the OTs a little bit. So what we did is we have developed a task force, and this task force is made up of a number of therapists from all different practice settings that are really experts. Some of them are your professors out there, those you in school in California. And our Practice Act doesn't reflect the current scope of what you are learning in school any longer. And we really feel that we need to update it to allow you to practice at the top of your education, because you can be educated in California and go across the border and be able to do dry needling in Arizona, and you can't do it here, or you can order x-rays in another state and it's hard to do it here, those types of things. So this task force has been working on this a couple of years. This is the year where we're presenting what it is we propose to do to our membership, and to get feedback from everybody on that. But not only that, we have to deal with the opposition. So if we're going to do things like adding prescriptive authority for x-rays, for topical medications, for tissue penetration, which is dry needling, and for additional ability to supervise more people, and to even change our regulatory designation to DPT. So right now in California, if you graduate and you're licensed as a PT, you should, in order to properly identify yourself, you'll see therapists use the designation of PT, DPT, because in our Practice Act, it doesn't state that we have exclusive rights to the title of DPT. So it's not a protected designator. PT is protected. So a personal trainer cannot put PT after their name. That's illegal in California. They could put DPT after their name and say it's something else. So we're trying to get that changed also. So that's just kind of a minor thing, but this is a big effort across the entire country, where APTA has asked every state to try to get the designator as DPT. So the work group has completed all of its work for the most part. We have had input from different committees in our association, and now we are going to get input from external stakeholders. This is, again, an area where we may be asking for your help to educate legislators, and to educate and to help us lobby California Chiropractic Association, the California Medical Association. Probably the biggest opposition we're going to see is from the acupuncturist groups. There are 26 different acupuncture associations in California. Physical Therapy Association is the only true association for physical therapists in California. There's an independent PT association for some private practitioners that we work with. But in acupuncture, there's 26 different associations. So they're probably all going to come out of the woodwork opposing us doing dry needling. So that's something we're going to have to deal with and try to overcome that opposition. So, I kind of, as you put on your thinking caps, I kind of like to, to hear from you, and we can do it at the end here as the wrap up, areas that you'd like to see us be able to do that we can't legally do in California now, that maybe you're aware of in other states or you've heard about. So how come we can't do that? We want to make our scope of practice related to dealing with movement disorders and mobility and that sort of thing, which which can go back, incorporate cardiopulmonary, pelvic floor, all those types of things. Right now, we can do a lot of that, but it's not described real well in our Practice Act. So dry needling is a big area, and right now it's prohibited for us to do dry needling. The only people that can penetrate the skin as physical therapists are those that are licensed to do EMG and NEMG. And there's only right now in California 50 of those practitioners out of all the physical therapists. There's approximately 26,000 licensed PTs and PT assistants in California. And out of those, there's 50 that do dry needling. Not dry needling, that can do EMG. Even doing those EMGs, they still can't do dry needling because they are only restricted to only doing the EMGs. So we have to remove that prohibition. And the current law, this is our current law that says a physical therapist is certified by the board to perform tissue penetration evaluation, and provided the PT does not develop or make diagnostic, prognostic interpretations of data. So I'll tell you that the PTs that do the dry needling, I keep saying that do the tissue penetration for EMG are really skilled practitioners. I mean, they know their anatomy pretty darn well. I've had it done on myself by physicians and by PTs, and the PTs doing the EMGs are just so far advanced in terms of what they're doing. And right now, it's interesting, there are some therapists that are able to do dry needling in California. And those are the ones who work for the VA, because the VA is on federal land, and they don't have to abide by the California Practice Act. So we do have some PTs, and they have been an advocate for us in working with our state and with the PT board to get them on board to say, hey, wait a minute, therapists are capable of doing it. If you think about it, in school, it's estimated that about 90% of the knowledge base for doing dry needling you learn in school. What you don't learn is the didactic part of actually doing the procedure, which you can learn fairly easily by additional Con Ed courses. But the basis for understanding what you're doing and what your purpose is and what structures to stay away from, the anatomy and everything, you learn in school. So we're right now, either we're looking at incorporating this into our modernization of the whole Practice Act, or doing it as a separate bill, and that's something we're going to determine this year. Something that may apply to some of you interested in going to other states, or those of you from out of state that still want to come back and practice in California. There's something that is called the PT Compact, and the PT Compact is saying that you participate with this National PT Compact organization that allows you to just say, I want to go practice in this other state that participates in the compact, and you pay a fee, and you're automatically allowed to go ahead and work in that state. California does not participate in the compact. So these are the states that are in a compact. So if you work in any one of these states in the green and you want to work in another state in the green as a traveling therapist, it's very easy to apply to the PT compact, and you can get approved within days or a couple of weeks to work in that other state. Whereas if you're in another state and you want to come to California, that you would have to actually go through the licensure process and take the jurisprudence exam and wait to get through it. And we know how real that is, because we have employees that come to work for us and they got to wait as a PT license applicant until they get through that process. And we had a bill 3 years ago, my first year as president, that we tried to get the PT compact through, and the state would not do it, and mainly because California feels that they are kind of at a higher level of authority and investigation ability than other states, meaning that we do FBI background checks, and some other states don't. So they say that other states are not at the same standard we are in terms of background checks, and therefore they're not going to honor the license of other states, which is kind of crazy. But that's the state. So right now, California doesn't have really any compacts with any medical, so with any nurses, with doctors, or anything else. And you would think that PT would be pretty easy. We all take the same boards, the national boards. So the competency level is equal. It's just that background check of the individual is what's holding it up. So I'm not sure we're going to get by that hurdle. We may try to go for this again, but it's a stretch, but unfortunately. So here are some federal issues that you want you to be aware of. And first one here is the Empower Act, which mandates general supervision for PT assistants in outpatient practices. So until the pandemic occurred, in order to get Medicare to approve payment for a physical therapist assistant in an outpatient practice, there had to be a physical therapist present at the same time for direct supervision. During the pandemic, they lifted that restriction and said, no, just the PT has to be available through telecommunication to the PT assistant. And so through the pandemic and through the end of this year, it is okay for a PT assistant to operate in a independent, not independently, but under indirect supervision of a PT to get paid by Medicare. In the state of California, it is legal to have a remote supervision of a PT assistant by a PT. So it's legal to do it. We just can't bill Medicare. So we're trying to get this changed permanently. Another thing we're trying to do is to make the Telehealth Act permanent. Another physical therapists and occupational therapists are not allowed under Medicare. We're not allowed to bill for telehealth services until the pandemic. And then they allowed it to occur. So all these things are happening during the pandemic. And now our argument is, okay, for the last 3 years, did we kill anybody because we had somebody, a PT assistant, supervised remotely? Did we kill anybody by doing telehealth with a therapist remotely? We've allowed increased access to care. So the APTA is introducing all these bills to say, hey, listen, we had the best way to prove that this stuff is okay with the pandemic. Let us do it permanently. So these are things that we're going after. There's something called MIPS, which you guys will learn more about in school or later on, which we're trying to change a little bit and modify, which is an administrative burden for us, but we're trying to change that. We're trying to get PT students and with loan debt to be part of the Workforce and Patient Access Act, which means that it'll allow you to have some loan repayment through federal forgiveness. If you work in an approved site for at least 2 years, we're not part of that group right now. Nurses are. We're not. We're trying to get added to that. And there's something called locum tenens, which is basically how you can bill under Medicare if you're a traveling therapist, which now is a little bit difficult to do. So I want to kind of emphasize membership to APTA. These are the people fighting for you on your behalf to advocate for the profession, to get all these things passed. If you're not part of it, you're kind of out of the loop in all this, and you don't really have as much of a voice. So I push for this. There are these transitional dues that are lowered during your first 2 years of membership, and then you go to full membership. And I basically say it's insurance for the profession. And so I'm a big proponent of being a member of our professional association. It just allows you information. I give Spine and Sport a lot of information because of my relationship, but you can individually get that yourself as a member. And there's a lot of promotion that we do, CPTA, that's been great. We have our own public-facing website, movept.org, and I think that's really great for the public to see. If you didn't see it 2 years ago, we had a float in the parade. CPTA celebrated the 100th anniversary of the APTA by having a float. I was myself and our APTA president Roger Herr were on the float, and it was just a fantastic experience. And to this date, it's the largest exposure of physical therapists to the world in one day that's ever occurred. APTA recognizes that too. So it was like the greatest PR that we could have possibly have gotten. So all these things I've kind of talked about already, but there's a lot that you can get through APTA and CPTA and staying up to date. And probably a lot of things I told you today you had no idea that were going on. And if you stay active in the association, those of you in California can get active in your local districts. You can be on any of the committees that we have national, state-wise. There's professional consulting services for those of you who want to set up businesses. We have discounts for our legal staff, and there's a lot of avenues for expanding your horizons on your career and learning, having resources of how to set up your own businesses, how to be involved from a leadership standpoint, and that sort of thing. So that's kind of where things are. I'm trying to get this done to leave us a couple of minutes let me stop sharing. And I spoke really, really fast. I normally give this lecture in like an hour and a half, so I apologize for that. So anything you want more information on, I can share this as Patrick said, this is recorded, but I can also share the PowerPoint with you if you like. It's